Welcome, everyone, and thank you for attending this morning's briefing. Those of you here in Pittsburgh and around the surrounding communities of the state and the communities that we serve in New York and in Maryland. I am Tammy Minier. I'm the Chief Quality Officer here at UPMC. I appreciate the opportunity to have a chance to speak with you about our new coronavirus here in the United States, which is causing a disease known as COVID-19. Right now, we do not have any known cases in Pennsylvania or the communities that UPMC serves. If that changes, we have been putting measures in place since early January to quickly respond. Preparing for infectious diseases is something UPMC has had a lot of experience with. We have very good partnerships with our local Department of Health authorities and our infectious disease experts at Pitt. We have always had solid plans in place to care for patients with emerging infections. UPMC facilities and staff are well equipped to properly care for patients with contagious diseases while not exposing other patients, staff, or visitors. I have invited several of my colleagues here to join us today who are the clinical experts at UPMC. We have with us Dr. Donald Yealy, who is the Chair of Emergency Medicine at UPMC and Pitt School of Medicine, Dr. Graham Snyder, who is our Medical Director of Infection Prevention and Hospital Epidemiology at UPMC, and Dr. Kristen Mertz, who's a medical epidemiologist at the Allegheny County Department of Health. I'm going to turn this over to Dr. Yealy initially for his comments.
Thank you very much, Tammy, and thanks to everyone who came today to gain a little more insight not only into the infection and the response regionally, but to the UPMC preparation behind this. You're an important part of helping not only us prepare, but for us to get the message out to the people that are the most interested, and that is our patients and our neighbors. From Pittsburgh to Harrisburg, Williamsport to Erie, UPMC is the trusted source for medical information and for care. We are a world-class academic medical center. And what that means is that we provide outstanding patient care, and we do the research that helps us improve that medical care. In this current healthcare challenge, those attributes will help us respond best to our community near and far. For the COVID-19 threat, UPMC began preparing starting in January together with our public health partners at the local, state, and federal level. Let me detail what some of those preparations produced. First and foremost, our emergency departments, our urgent care clinics, and our physician offices are the front lines. I appreciate the professionalism, the calm, and the engagement that all of those people, the leaders, the physicians, the nurses, and the staff have already invested into learning and relearning about how to provide care under this particular threat. We have had screening guidelines in place for this specific infection at all UPMC facilities since early January to help us detect anyone who might be at risk for having contracted this new virus. These screens initially use travel and symptom information. We've trained our staff to know what to do next if encountering a potential COVID-19 infected patient. That starts with placing them in a comfortable area away from other patients to prevent any other spread and to begin the evaluation and natural infection prevention procedures that have been around for a century. These procedures include proper placement and masking of a patient using the best devices, providing ongoing instruction to both patients and staff about hand hygiene. Washing your hands is still the most important thing. Careful patient contact, and then calling our hotline. Our hotline is ready 24 hours a day, 7 days a week, and it has experts who can help determine whether or not the patient is a potential COVID-19 infected case. We also have direct communication to key personnel at the Pennsylvania Department of Health. Working together with those people, we're able to best determine which patients need testing. Late last week, the CDC broadened the screening guidance beyond just symptoms and a travel history to China. They added other travel locations, and they also added other clinical features that might trigger the potential for testing. We updated our screening accordingly, and we remain vigilant in watching for potential COVID-19 cases. We still have not had any cases in need of COVID-19 testing based on the collaborative expert decision-making that we've already had in process for weeks here. We are proactively trying to find cases. We're not waiting for them to become one in front of us and become obvious. So you might ask, what can I do? So my first ask of you as a physician would be that if you suspect you or a loved one has a COVID-19 exposure or infection, and you are not having high fever or breathing difficulties, call your primary care provider first or contact us on an electronic platform, Upmc Anywhere Care. That'll help you get initial advice about what to do next. And not only will you have that advice, we have the opportunity to prevent further spread if you are infected. If needed, we can guide you to the next steps of care and the next care site and be prepared for you. If you have high fever or breathing difficulties, go to your emergency department. Our UPMC sites are ready to take care of you. No cases of COVID-19 have been reported in Pittsburgh or in any of the communities that we serve in Pennsylvania, New York, or Maryland. We also do not have any cases in our international facilities or with any of our international staff, and we remain in constant contact with those people to make sure that we're handling things appropriately. We stand ready to take care of patients who might be infected with COVID-19. Let me turn things over to Dr. Graham Snyder now.
Thank you, Dr. Yealy. SARS, Ebola, influenza, H1N1, these are infectious diseases that UPMC has taken care of in recent years and prepared for. We continually screen for emerging infections and have for decades. In developing our COVID-19 preparedness measures, we started ahead of the curve, building from what we've learned during these previous epidemics and pandemics. As Dr. Yealy explained, we have had screening guidelines in place for nearly 2 months, and we have systems in place to allow us to quickly adjust and disseminate updated screening guidelines system-wide as public health authorities update their guidelines. While we've been preparing to detect COVID-19 cases, we've also been preparing to safely care for patients with COVID-19. There are no cases of COVID-19 at any UPMC facilities presently, but we are ready should we have a case. The measures we've taken to be prepared include regular contact with our partners at local, state, and federal public health authorities. When we have questions, we receive very prompt replies, and we appreciate the guidance. Extensive communication with employees to share what they need to know and explain UPMC's preparedness. We've had several in-person and live chat sessions where we answer questions. We also have an email address where employees can ask non-urgent questions and get answers. For urgent inquiries, we have a hotline that is staffed 24/7 by our infection prevention team. UPMC healthcare workers are educated to recognize potential COVID-19, use appropriate precautions, and immediately get system assistance for evaluation and management of any potential cases. We have a strong supply chain system in place to ensure we are receiving an adequate supply of personal protective equipment, such as masks, gloves, and gowns. We keep a rotating stockpile in several secure locations. We are closely tracking our allocation of these supplies to our facilities to make sure they have what they need, but that none is wasted. The FDA recently announced that they are expanding permission for COVID-19 diagnostics to qualified labs nationally. We are working quickly to develop our own testing capabilities so that any cases can be identified more rapidly. We've also temporarily suspended all business travel to China and Italy. We will continue to monitor the situation in other countries where UPMC conducts business and respond appropriately. Staff who return to the U.S. after traveling to areas with sustained transmission must report to employee health and be evaluated before they return to work. A small number of staff have been self-quarantined at home with appropriate compensation. Everyone has been very cooperative, and nobody has developed illness. I would like to thank our nearly 90,000 employees for keeping themselves informed about COVID-19 and UPMC's preparedness through our intranet. Our community can be reassured that UPMC facilities and staff are well equipped to properly care for patients with contagious diseases, including COVID-19, without exposing other patients, staff, or visitors. In addition to calling ahead before coming to the doctor or hospital, other things people can do are what you would do to prevent the spread of flu. Wash your hands with soap and water and hand sanitizer if soap and water is unavailable. Cough or sneeze into your elbow or use a tissue that you promptly discard. Stay at home when you're sick. The CDC does not recommend healthy people or use face masks at this time. Hand washing and avoiding touching your face are much more effective interventions. Lastly, stay informed. The CDC is the best source of information for people in the United States. Dr. Mertz will now discuss how our partners in the Allegheny County Health Department are preparing.
Thank you, Dr. Snyder, and thank you for inviting me to join you. As has been mentioned, there are no confirmed cases of COVID-19 in Pennsylvania at this time, but we expect to detect cases in Pennsylvania during the coming weeks, and we are preparing accordingly. Since the announcements of the outbreak in Wuhan, China, Allegheny County Health Department has been in communication with state and federal agencies, and we are continually updating our guidance. We have also been communicating and responding to questions from stakeholders, particularly healthcare providers and healthcare systems, schools and universities, businesses and restaurants, and transportation agencies. Since February 3rd, we have been monitoring travelers coming back from China, telling them to stay home and collecting daily information on their temperature and symptoms. Given the likelihood of local spread of COVID-19, we are expanding our prevention efforts to include community mitigation measures designed to reduce transmission and keep case counts low. These prevention efforts fall into 3 categories. 1, personal protection. Wash hands, cough into your elbow, stay home if ill, avoid handshakes. 2, social distancing. Keep people from congregating by teleworking, closing schools, and canceling mass gatherings. And 3, environmental cleaning. Frequently disinfect high-touch surfaces. Routine use of personal protective measures by individuals and their families can go a long way to prevent the spread of illness and help us respond to the outbreak. Social distancing decisions are more disruptive and often must be made on a case-by-case basis, but can reduce transmission. A couple of additional recommendations include getting the flu shot if you haven't already. If we reduce the number of people who need care for flu, we have more resources available for persons with COVID-19. And finally, those traveling should take certain steps. The CDC is currently recommending that individuals avoid non-essential travel to China, Iran, Italy, and South Korea. Additionally, precautions should be practiced if traveling to Hong Kong or Japan. The CDC has also recommended that all travelers reconsider cruise ship voyages into or within Asia. Be aware that the global situation is changing rapidly, and you should check the CDC travel website before going abroad. Thank you very much for the opportunity to speak.
Thank you to our speakers and to all of you for attending. We now have some time for questions, and we'll also be including questions from our remote media participants, which I'll intersperse within. Questions?
Are you evaluating any possible cases of the coronavirus?
We are continually alert for potential cases of COVID-19, and I can't disclose any particular information about patients. We have not tested anybody for COVID-19 to date.
All right, so I have a question here from the Post-Journal in Jamestown, New York, which is where UPMC Chautauqua is located. With the first confirmed case in New York State, has UPMC reached out to New York State officials to set up and plan for virus testing protocols for residents who live near UPMC Chautauqua?
Sure, that's a great question. As we all work to respond and keep track of the emerging locations, all of our regional facilities really do have very close contact with their own Department of Health in their state. This includes our colleagues at UPMC Chautauqua, who have been working closely on an ongoing basis with their Department of Health. If it becomes necessary to do testing at UPMC Chautauqua, we will follow the guidance of their state department, just as we would our own here in Pennsylvania or in Maryland, as patients would need care.
Okay, question from the room? Yes.
Can you explain why healthy adults don't need to wear a face mask?
So the question is, can you explain why healthy adults don't need to use a face mask?
The virus is transmitted person to person, and one of the ways is through droplets in the air, one of the ways is through close contact. A face mask could provide some protection, for example, in the healthcare setting when we have close interactions with a patient who may transmit an infection by droplets. But in the general sphere, in the general public, when you're at the grocery store, on the train, the likelihood of coming into contact is much smaller. There's also a theoretical risk that by wearing a mask, you A, are not well trained in how to wear the mask appropriately to make it effective, and B, you might be more likely to touch your face, and after having touched surfaces that could be contaminated, then increase your risk of acquiring it. That's why we're focusing on some of the key interventions that Dr. Mertz outlined, which is hand hygiene, respiratory etiquette, staying at home if you're well, thinking about the surfaces that you contact in your house.
Okay, next question. Yes.
In your simulations and the preparations that you have been doing up to now, what has been the sort of worst-case scenario that you've been looking at for right here in Pittsburgh?
The question is, what has been the worst-case scenario that you've been preparing for here in Pittsburgh?
Well, I think there's several things that could be quite serious, but I think the most concerning is the possibility that the elderly become ill. So I think I'm most worried about long-term care facilities and outbreaks there because the population is so vulnerable.
What about numbers? Do you look at any sort of numbers in terms of what, in terms of how you game plan this, about how that could be potential and how you respond?
The question is, have you looked at any numbers and how would you respond based on those?
If you mean, have we done any mathematical modeling type exercise? Yeah, no, I mean, the worst case scenario would be like Wuhan, China, where a large percentage of people become ill. We don't think that will happen here, one, because we are more prepared for the virus now. They had the disadvantage of being the first place where it broke out, but we have been monitoring travelers who are coming from affected areas. We are getting ready in terms of all the community mitigation measures I mentioned, like promoting hand hygiene, getting ready for social distancing, promoting cleaning, and all those things can go a long way from reducing the impact of the epidemic. We also have the advantage of delay in that China's now doing clinical trials on some antiviral medications, so we're hoping that we start seeing results of those in the next month or so, and that should also help lower the severe outcomes if some of those drugs prove to be effective. So there's several reasons why we don't think it's going to be severe here as it was in Wuhan, China.
I'm going to take one more question from our remote participants. This is from Harrisburg Media. Has UPMC felt any pressure as of yet regarding the shortages in medical equipment produced overseas? How would you combat a shortage if it were to happen?
So we have not felt that pressure yet. One of the things that we are very proud of is our very strong supply chain partnerships. And we are not sitting back and waiting for any of those pressures to come early to us at this point in time either. We are proactively working with those suppliers and vendors and always internally looking to see what are our own conservation strategies should that occur. So to date, feel that we're in a very good position and continuing to see our supplies grow every day.
Natasha, I think you were.
Can you tell us more about what it'll take to develop your own tests? And, there's been a lot of doctors coming out in New York who are upset there isn't more testing happening. They say other countries are doing 10,000 a day, and all New York City's done 32. There's been some increase in the CDC availability, and how long it takes to that. So tell us more about what the benefit of doing that, how long it will take you guys to do that, and what the goal would be.
All right, this question is around testing and UPMC's efforts to develop a test.
We are working quickly to develop our own testing capacity, and this is obviously a priority as we'd be able to test patients more quickly if we do it here within our organization. I do not have a time yet for when that would be available, and at the time, presently, we are of course collaborating very closely with our colleagues at the Allegheny County Health Department and other local health departments, as well as the PADOH, to coordinate testing when that need arises.
How long does it take to get a test back currently?
So up till this point, the testing has been done at CDC, and that takes probably 2 to 3 days by the time you get the specimen there and get it tested. Now they are starting this week to test at the State Health Department, and so we should be able to get results in about 24 hours.
All right, next question from the room. Yes, Sean.
Dr. Ewing and Dr. Snyder, you both said that you felt confident that you've been prepared, that you were following the guidelines about the CDC guidance. But given, in particular, the example of Kings County, Washington, and some of the analysis there, what do you think the likelihood is, based on your experience, plus what you know about the population you have here, how many people have been evaluated, if not tested? Do you think the possibility is that there have been cases here, but they've gone undetected, not just by you, but by others, especially given the population, as Dr. Merz pointed out, they've been evaluating and tracking very closely those people who have returned from China?
The question is, in light of Kings County, Washington, and the outbreak we're seeing there, what do you think the likelihood is that a similar situation is happening here?
So I wouldn't be able to offer a guess about an event that we don't know anything about and that ostensibly we have no evidence has occurred yet. Maybe what you're asking is what's the likelihood that we will detect a case? And I think that's exceptionally high given what we know about this virus right now and what we've seen around the rest of the world. The real question is how many will be here and how will it impact not only individual patients, but our ability to care for them. And I think we're well positioned based on the experience of others and our preparation to handle that real well.
I really did mean, do you think that we've missed some cases here based on what's happened in Washington? They believe strongly, some of the analysis there, that for 6 weeks it was transmitted around there. As you said, you haven't tested anybody here because the CDC threshold was travel. Community spread was not anticipated until fairly recently, until the first community spread case. Is there the chance that there have been cases here already, but 80% of them or more have been mild, as we reported? They might have presented as just flu or something less than flu.
Is it in the realm of possibility? Yes. Would I be able to give you a numeric answer to it? No, and I don't think anybody could offer that to you.
Yeah, emerging infections are complicated things, and by their very definition, this is a new pathogen that the world is just learning about. The rate of science that's coming out about this new coronavirus is unprecedented. It's incredible. And transmission dynamics in the community can be very hard to predict. And so why one community may be affected first and another community may not be affected is extremely difficult to predict. That's difficult to predict even in influenza season. Why does one state have higher activity than another state? And and we know a lot about the flu. So that's why it's very difficult to say, have we had cases here or not? Our focus is to make sure that we're doing everything that we can to identify a patient who's ill with COVID-19 in our community.
All right, I'm going to take a question from our remote participants. This one is from Rick Kasmer at the Somerset Daily American, and he asks, we've had some criticism that the media, generally, is blowing the coronavirus out of proportion. How serious of a concern is this compared to the annual flu?
Well, the flu is, as we all know, a very serious annual virus that we all deal with. Every year, UPMC provides care to hundreds, thousands of patients with the flu. The COVID-19 symptoms are very similar to the flu, but the virus is not the same. So this is a new virus, as Dr. Snyder was just mentioning. It is evolving from a understanding, care delivery, and detection perspective very rapidly. I think media coverage of emerging infections and existing infections is very important to our public health. It's a critical issue, and we count on your partnership to do those things well. I would ask each of you, though, to make sure you're using factual sources. That is really the critical point. In an emerging situation, we know they're limited, but as much as possible, sticking to those would be our initial comment as far as the partnership with media.
All right, we have about 5 minutes left. Yes.
I thought I would elaborate more on those more at risk, like elderly. Should restrictions be in place for people visiting nursing homes and things like that, especially for those who are in those long-term facilities?
Okay, this isn't asked to elaborate more on those most at risk, particularly nursing homes. Should there be restrictions?
Yeah, I mean, the policies that we're recommending for long-term care facilities are similar to what we recommend during flu season because the transmission is probably quite similar. So we do recommend that long-term care facilities put up signage saying that if visitors have respiratory symptoms to please not enter, and then to just watch their population carefully to see if they develop fever or respiratory symptoms and get them tested for flu and other respiratory illnesses. And yeah, definitely take the measures that you would take during flu season to prevent the introduction of the virus into the facility.
Next question. Yes.
If a person fits the criteria, they need a test, how much does that test cost? I'm not sure if you can answer that question or if insurance covers it, because we keep seeing these things, especially on social media, where a person gets billed $1,000. Is there any type of thing that you tell the public on what they can expect if they do get into a situation where they need this test?
Okay. The question is, if somebody needs a test, what is the cost?
We obviously don't know the answer to those questions yet. We would follow our normal procedures at UPMC regarding that, but no one would ever be refused care as a result of their inability to pay.
I can say that the tests done by the public health system are free to the patient. Yeah, the cost is borne by the.
And let me just clarify one thing. There's the test for the very specific virus. I think that's what you're asking about. Patients often get other testing, and that would be covered under whatever mechanism existed if they had any illness.
Do we have another? Yes, I don't think you've had a chance yet.
What are some of the unique risks in rural communities and some of the problems with COVID-19 entering those communities?
What are some of the unique risks to rural communities in particular with COVID-19 being able to enter?
Well, as we've talked about before, the transmission pattern of any infectious disease and any virus is quite variable for many reasons. And in a population that's less dense and has a different pattern of individual contact, it'd be virtually impossible to predict how many people might eventually be infected. And so that's one challenge to begin with. Just being less dense doesn't make less risk. It means it's just even less predictable, and predictions are hard anyway. Secondly, the access to health care may differ in a more rural setting. That could be an advantage or a disadvantage. As we talked about before, if you're mildly symptomatic or completely asymptomatic, perhaps a phone call or a telehealth visit is exactly the right thing to do, and someone in a rural setting would have the same access as in an urban setting. Where they may have varying differences is their access to hospitals may differ just based on geography, and that could, in theory, alter care. We don't expect that to be a major problem, but I don't know yet.
As an organization, we've had system-wide coordination. So we have conversations with all of our colleagues, whether they're in a rural hospital or here in Pittsburgh. to make sure that all of our facilities are prepared with the same level of preparedness, evaluation, and supply chain. So I think it's important for those of us in our community, in the UPMC community who live in smaller areas, smaller towns or rural areas, that we're making sure they're prepared as well.
Okay, yes.
If a person believes that they have this virus and they go into the emergency room, is there a proper protocol in place if they say to whoever is intaking them, I think I might have this? Is that person immediately quarantined? Is there any kind of process in place to mitigate any further transmission?
Please describe the protocol if somebody who suspects they have COVID-19 were to enter one of our emergency rooms.
So the answer is absolutely. We began very early on training our staff about how to screen for patients. We talked about that a little bit earlier, beginning initially with symptoms and travel history, now adding the new travel features and some of the other symptoms. Secondly, the UPMC facilities in particular, we operate under a set of conditions in which patients don't very often have a long time in the waiting room. We do that for a great many others. It's just good patient care. So that limits the opportunity to have a delay in care or to have further spread. Once you're recognized as being a potential for COVID-19 based on that screening, you're taken to an appropriate area, offered a mask and instructed on how to use it, and we have our staff trained on exactly how to interface with you, what questions to ask, how to provide your care, and very quickly tie into our infection prevention team to get the best possible decisions. So that's a longer answer to, we're ready for this.
I'd just like to add to that, we really encourage people who think that they have the novel coronavirus to please call ahead, to not just show up at an ED, but to call their healthcare provider or the facility where they want to go or the health department before going, and that gives the providers time to prepare.
What about if it's off hours, like in the evenings?
Yeah, same. Still call the ED wherever you plan to go, or your PCP answering service, or the health department.
All right, yes, Sean.
Dr. Ewing, Dr. Snyder, do you have any sense of the network of physicians, especially here in Pittsburgh, your urgent care centers, your emergency departments, how many calls or requests for, I think I have COVID-19, it could be flu, but I'm not sure. Do you have any sense of how many? Has it been hundreds, thousands of people who were worried that they had it, were called to ask, are my symptoms likely to be COVID-19?
All right, this question is about volume of calls related to COVID-19.
There are a few avenues in which we may consider a patient who has COVID-19. A patient may call. A physician's office may recognize that potential and call the system infection prevention team to review the case. They may present to an urgent care or an emergency department. We don't categorize them in quite the way you've put and say, here's the whole catalog of cases that we have discussed and reviewed. And I'm sure that physicians' offices have fielded a lot of questions to educate their patients. We've provided physician offices, urgent cares, emergency departments with information to empower them to be able to talk to patients about it. So I don't know how many patients have called and asked, but we do know that we have all of those avenues open so that we can help identify a patient with COVID-19 if they have it.
All right, we have time for one more question. Yes.
You said that a small number of staff at UPMC was quarantined. I thought you said that when you were at the podium. Does that mean that someone came in and suspected they had coronavirus?
Please clarify about the staff that have been quarantined.
No, none of our healthcare workers have been suspected to have the coronavirus. Like I said, we haven't tested anybody for it. Consistent with public health guidance, returning travelers from areas where there's local transmission, and we've had for China and the additional 4 countries that have been added, guidance for the general public returning for those countries. So we have helped our healthcare workers returning for those countries follow that guidance. And done it in a way that's compassionate to them as healthcare workers and employees of the organization to make sure they stay well and we give them the guidance that they need.
All right, and with that, that concludes our press conference. I would like to thank you all for coming. We're planning to do regular, possibly weekly updates. We want to keep our media partners and the public in the communities we serve up to date on this evolving situation. Thank you very much.
Thank you.